Joining us now here on Midday is Dr. Henning Ansorg from Santa Barbara County Public Health as we get our weekly update on the coronavirus pandemic. Dr. Ansorg, nice to see you again. Thanks for doing this. Let's start with the new push to get more testing done. Why is it so important for people to go and still get a COVID test?
Yeah, at this point in the pandemic, we still have widespread spread of the virus, and to identify people who are positive as soon as possible is really vital in getting this pandemic under control. Bear in mind that at least 50% of people who have the virus and spread it feel perfectly well. So we really want to encourage people who've been, maybe not behaving in an ideally safe way to get tested frequently. It's free, it's easily available now, just to make sure that we get this pandemic under control.
And we have the site that's out at East Beach right now. It's free. You can sign up and go get a test and hopefully help keep us moving along in the tiers here. All right, now to vaccines. More than 12% of Santa Barbara County adults have been fully vaccinated. 25% have had at least one shot. That means 75% of adults haven't had a chance to go get a COVID vaccine. What is the biggest obstacle that you still face when it comes to vaccinations?
Well, the big obstacles is really still the availability of vaccine, even though it is improving, I must say. We are making strides, but it's still limited. And especially the allocation that comes from the state is fairly limited. The federal government is really pushing out a lot of vaccine supply to programs to pharmacy directly, and also to federally qualified healthcare centers, and that will help greatly in the next 2 weeks, also for us here locally.
Some people are asking, if they want a certain vaccine type. Most are okay with getting whatever they can get their hands on first. But let's say you want the Johnson & Johnson, is there a way to find out who has that and where you can actually get it?
Yes, there actually is. Transparency is really important. Everybody who does give a vaccine is totally transparent of which vaccine is available, so to speak, on the menu of the day, and people can go and pick, yes.
Okay, and if you want the Johnson & Johnson, is that more available at pharmacies, let's say, or at public health, or do you know?
It is not as available at pharmacies, actually.
Okay.
However, it is available at Samson Clinic in Santa Barbara. It's available at the county clinics, at the what we call PODs,
right?
Also, like the big centers for vaccinations. So yes, and you can see it actually online. If you sign up for My Turn, it will also tell you what kind of vaccine the particular clinic is having.
All right, now what about variants now? They seem to be popping up all over the place, different ones. California now has its own variant that's becoming more prominent. How concerned should we be about these?
Yeah, viruses mutate all the time. That's normal for viruses, and they try to become smarter, and they do. Why these variants now, like especially the UK or the California variant, becomes more dominant in an area is because they are smarter in that they can spread faster. So they infect people easier. It's easier for them to infect people, and they just move faster. So the California variant is now way over 50% of the viruses here, and those numbers are relatively old because we're lagging behind by 3 to 4 weeks with those results. So it might be already at almost 70% as we speak right now. So the UK variant has taken over Europe, really. I mean, completely. And fortunately, I think we're a little bit protected because of our California version, because that's pretty fast too. So the UK variant has run for its money to compete with the California variant, but both infect faster and therefore take over.
Youth sports has been another big topic lately. Most of them put off for nearly a year, and now that we're in the red tier, things are starting to ramp back up a little bit. What's allowed and what's not allowed with youth sports?
Well, a lot is allowed in youth sports, actually. We even allow high contact sports like football, water polo, rugby, basketball. Anything is allowed, really, but it needs certain requirements. Like, for instance, football and water polo is mandatory as of right now that they have weekly testing to make sure because they're really in their face and they are really, really working hard, you know. So it has to be safe for the athletes and the teams and everybody involved. So that's why the testing is still mandatory.
And when it comes to high school football, I've actually had a couple of games that have had to be postponed this week. They're supposed to be on Friday because of testing that has popped up. What happens next with that team? Is everybody quarantining or isolating?
Yeah, they are. And the schools are really doing a good job, the athletic directors and principals in making sure to postpone games or whatever they can do. Sometimes they have to cancel, and it's heartbreaking. I get that. But, you know, the safety has to come first.
Dr. Henning Ansorg, thank you so much for giving us an update here on the coronavirus live on Midday. We appreciate you joining us. And Santa Barbara County Public Health giving us somebody every week to talk to for a little extended conversation in the middle of this pandemic. Thanks so much.
Of course.